Hi, Kathy. My name's Rachel. I'm the nurse looking after you today. I've just got an order here from the doctor to insert an indwelling catheter because you're having difficulty passing urine and you've got 600 mils in your bladder. So basically the procedure involves inserting a small tube into your urethra, which goes into your bladder, and the urine will drain out via that tube into a drainage bag. It'll make you feel a lot more comfortable. Is it okay if I continue with the procedure?
Yeah, that's fine.
Have you got any allergies that you're aware of?
No, not that I know
No
of.
worries. Just going to check your UR number here against my order. So Kathy Jones, UR number 120824, 29th of 3rd, 1980. Beautiful. I'll just get everything set up and I'll come back.
Okay.
And so I've got a clean trolley, which I've cleaned down with a toffee wipe, and I've gathered my equipment and I've brought it back to the bedside. I've attached a rubbish bag on the side. Hand hygiene, and I'll open up my sterile field. Empty out your top tray. Okay, now I'm going to add equipment to my field. 10 ml syringe to a height of 15 centimetres. Sterile water. And sterile lubricant. I'm going to get some tape ready to secure my catheter at the end. And I found an assistant. I'm just going to pass her the catheter, the drainage bag and fluid. Now that that's all, I've added everything to my field, I'm going to set up my sterile gloves. And this is when I would do my 60-second clinical hand wash and come back. So glove your dominant hand first. And come back to your field. Now that you've got your sterile gloves on, you can touch things within the field. So separating my trays. Firstly, going to draw up my 10 ml of water for my balloon inflation. Okay, 10 ml. Going to pop in 5 cotton balls into the water. That's for cleaning. Pop them at one end of my tray with one pair of tongs. Empty out my tray. Okay, now I'm going to ask my assistant to hand me the catheter. When taking it out of the packet, take it with 2 hands and take the inner packet as well. It's all sterile. Now you can rip the packaging off. Because it's sterile, I can pop it into my field. Saves partial contaminating your hand when trying to put it in the bin. So fold that up into my field. Now to prepare the catheter for insertion, I must lubricate the tip. Okay, 5 to 7 centimetres. And then attach my 10ml syringe to the inflation port. Just a push and twist and it should lock in place. And add that to my insertion tray. So I've got a cleaning tray and an insertion tray. And then I need my sterile drape as well. Okay, next is positioning the patient. Hi Kathy, we're back and all ready to go. Basically, I'm just going to get you into position now. So this is my assistant Sue, she's going to help me out.
Hello.
Just going to draw back the covers. What I need you to do with your legs is pop them up, pop your knees up to your chest, bend your knees, put your feet together and let your knees fall to the side. And we're just going to place the bluey underneath the bottom there. Okay, I'm going to cover you with this sterile drape. So please don't touch it. If you need something, just let me know. So I can reposition just touching the white side. Okay, patient's ready. Now I'm going to bring my trays across. My cleaning tray first, closest to me. My insertion tray further away. I've got my clean cotton balls up one end and my dirty cotton balls are going to go into the closer end, which means I'm not crossing over my sterile field. Place your hand on top of the drape to start with. At this point we're still completely sterile. Okay Kathy, I'm just going to start cleaning now. Might feel a little bit cold. Top to bottom. One swab on each side of the labia majora, top to bottom. Now my hand comes down and opens up the patient's labia. Clean inner aspect of the labia minora on both sides, top to bottom. And one swab down the middle. I will get rid of my cleaning tray. Now that this hand's here, I can't move it because it's contaminated because it's touching the patient. So the rest of the procedure I need to do with one hand. Okay. Insertion process. Now Kathy, I'm going to start the insertion process. It may be uncomfortable, but it shouldn't be painful. So let me know if it is and I'll stop. Okay, so inserting into the urethra. 3 to 5 centimetres for females, and I should start to see urine flow back in my tube. When this occurs, push forward another 2 to 5 centimetres to ensure that the balloon is wholly within the bladder. Now that I'm happy with my insertion length, I'm going to start to inflate my balloon to secure the catheter. At this point, my left hand, my non-dominant hand, has not moved. Once I've inflated the balloon, my catheter is secure and my hand can come off. Grab the inflation port, twist, pull, and can I please have my drainage bag? Attach your drainage bag. Next step we need to do is make sure the balloon is sitting in the neck of the bladder. It's just to pull back until we feel a little bit of resistance. And that catheter is secure and in the correct place. Okay, Kathy, that's all done now. I'm just going to get rid of this drape on you and secure the catheter to your leg. So get rid of all the drapes. Gloves off. Hand hygiene. I'm just going to tape the catheter. So secure it around the tube first to prevent the tube moving within the tape, and then on the patient's leg, ensuring that there's no pulling on the labia. The drainage bag then must be placed below the level of bladder to ensure that it can drain via gravity. Now that that's completed, you can cover the patient up and document. We need to document time and date of the procedure, why we undertook the procedure. So in this patient's case, we had urinary retention. We need to document the size of the catheter we inserted, the amount of water we popped in the balloon, and how the patient tolerated it. Also, we need to document any urine characteristics or any samples taken. Once we've done that, just ensure the patient's comfortable and get rid of all of our equipment. This all goes in a clinical waste bin. You can just wrap it all up together. And that's it.